Good morning. This is Teresa Anderson from the Health Department checking in with everyone again today. We've had a busy week last week. We are still watching very closely and monitoring new cases of COVID-19. This morning we'll report that we have 6 cases that are confirmed by laboratory test. There will be more, and we're at a point now where the testing is being expanded, so that's good news. We can test more people, but as we test more people, we're going to have a lot more cases. That's just the way it works. So we'll expect more cases. And in view of that then, on Saturday morning we issued what we call a directed health measure. The directed health measure is designed to protect the public, to protect all of you. And it may appear to be heavy-handed to some of you, but the directed health measure that was issued by Central District Health Department follows just in line with what the governor issued for our area as well. Knowing that we have COVID virus here, knowing that we have community spread, we need to take this action. Remember that what we're doing and the way that we're addressing this COVID issue is that if we can reduce the number of individuals who are sick at any given time, then we can reduce the impact on the healthcare system and we won't overwhelm our healthcare providers. If you've been watching the news at all on the national level and in other countries, you know that healthcare providers get overwhelmed. The hospital system can't tolerate it. Healthcare system is doing the very best they can, but at some point it becomes difficult to provide the care, especially when in the community there is spread of the virus. So our goal is to protect each other, obviously, and to protect the healthcare providers. And that's what our goal is right now. That's why we're limiting all gatherings to 10, and we're saying that if you go out, go do what you need to do, and then go back home. When you're out and about, have as little contact as you can with the smallest number of people that you can, and then get back home. If you have someone in your home that is sick, we're asking you to take these measures. We'd like for you then to isolate that individual to one part of the house. And the symptoms I'm talking about, gosh, they vary all the time. We keep adding new symptoms. We started out with shortness of breath, fever, and cough. And now we've expanded it, and the list is getting longer. Sore throat was added last week. Now what we're hearing is a lot of folks are losing their sense of smell and taste as one of the early symptoms of COVID-19 infection. We also know that some folks may have gastrointestinal symptoms, including nausea and diarrhea. So the symptoms that can appear are probably different in any individual. And we also know that some people have no symptoms at all, and yet they carry the virus and can infect other individuals, which happens with community spread. The sick people stay home, but people who are well or think they're well but are carrying the virus can infect others. So what we want to do is make sure that sick people stay home, and in your home, if you have a sick individual, a family member, or a roommate, then have them go to a part of the house where they can just pretty much isolate themselves. If there's a bathroom that isn't connected with others' use of that bathroom, then reserve that room for this individual who's sick. We're not suggesting that everybody who is sick call their doctor and ask to be tested. That's not where we are right now. We don't have that number of tests. What we are suggesting is that self-isolation or self-quarantine, and then if the symptoms become worse, and if you or a family member needs to see a doctor or a provider, please call first and tell them what the symptoms are so that they can prepare for your arrival. We're limiting the number of folks in providers' offices, and I should restate that. The providers are limiting the number of folks that they're seeing to try to protect the well people that would normally come to visit them for well checks. So you're going to see a different type of process used now than we have prior to this time, and you'll see it used for a long time now. We don't know how long the virus will be active in our community. I can tell you that we expect to see the number of cases increase. The latest predictions would tell us that our numbers will double every 4 to 5 days, and that's a generous leeway for that. So we have 6 cases now. We're expecting to see more. Maybe by the end of the week we'll have 12 cases. Maybe we won't. That's the unknown for us. But what we're asking for all the time, continually, is for your help as we work to reduce the impact of COVID-19 on our community. So staying home when you're sick is not our normal way of operating, but it's what we're asking you to do now. If you have questions, go to our website, cdhd.ne.gov, or go to CDC's website. There's also on our website is oh gosh, I don't know if it's 12 hours or 24-hour phone number that you can call Nebraska DHHS and ask questions there as well. So check our website, get those numbers, give us a call during the 8 to 5 work day, and we have been staying open on weekends from 8 to 4 to answer phone calls. We have halted our immunization clinics for the time being. We're doing our WIC services as best we can electronically. We know that people are going to be displaced from work and that they're going to qualify for WIC, and we can encourage anyone who thinks they are would meet the criteria, economic criteria, income criteria for WIC, to give us a call. We'll walk you through it. That program is there to help in situations like this. And so if you think you qualify for WIC, give it Women, Infant, Children program, I should say, so for cards that can help you purchase foods. We want to be able to do that for you. If you have questions about the WIC program, give us a call at give us a call at 308-385-5175, and we'll be sure to answer the questions that you have. With that, do your very best to stay well. We'll talk to you again next week. Thanks for listening, and let us know if you have any questions or any suggestions.